Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Farida Nurqomariah. I am from the first semester of Diplomacy in Blood Bank Technology of Poltekkes Semarang. Today, I will explain about sickle cell disease. But before I start to explain the matter, have you ever had sickle cell disease? Okay, I will start to explain about that you know. There are several points that I will explain to you. First, I will explain about definition of sickle cell disease. Second, diagnosis of sickle cell disease. Third, cause and treatment of sickle cell disease. And last, complication of sickle cell disease. Next, I will explain about definition of sickle cell disease. Sickle cell disease or SCD is an inherited blood disorder. This means it is passed down from a parent gens. It causes the body to make abnormal hemoglobin. This is the protein in red blood cell that carries oxygen to all parts of your body. When you have SCD, your body tissues and organs don't get enough oxygen. Healthy red blood cells are run and move easily all over the body. With SCD, the red blood cells are hard and sticky. They are shaped like the letter C and like a firm tall called a sickle. Thus, they make red blood cell or sickle cell clump together. They can move easily through the blood vessel. They get stuck in small blood vessel and block blood flow. This blockage stops the movement of healthy oxygen-rich blood. This blockage can cause pain. It can also damage major organs. Sickle cell disorder that healthy cell. Normally, the spleen helps filter infection out of the blood, but sickle cell gets stuck in this filter and die. Having fever, healthy red blood cell cause anemia. The sickle cell can also damage the spleen. This puts you at greater risk for infection. Next, how is sickle cell disease diagnosed? Your healthcare provider will take your health history and give you a physical exam. You may also have blood tests and other tests. My tests routinely screen newborns for sickle cell. This allows treatment to begin as soon as possible. Early diagnosis and treatment can reduce the risk of problems. A blood test called hemoglobin electrophoresis may be done. It can tell if you are a carrier of sickle cell. It can also tell if you have any disease linked with the sickle cell gene. Next, what are possible complications of sickle cell disease? Complication of sickle cell disease. SCD can affect any major organ, that liver, heart, kidneys, gallbladder, eyes, bones, and joint can all be damaged. They suffer damage for the abnormal function of the sickle cell and their inability to flow through the small blood vessel correctly. Problems may include 1. Increased infection, 2. Lack occurs of serious sores, 3. Bone damage, 4. Early gallstones, 5. Kidney damage and loss of body water in the urine, 6. eye damage, and 7. Multi-blood organ failure. What causes sickle cell disease? Causes sickle cell disease. Sickle cell is an inherited disease caused by a defect in a gene. When you are born with SCD only if two genes are inherited one from each parent. 2. If you have just one gene, you are healthy, but you are a carrier of the disease. If two carriers have a child, there is a greater chance their child will have SCD. 3. Parents who are each carrier of a sickle cell gene have a 1 in 4 chance of having a child with SCD. And then treatment of sickle cell disease. Treatment will depend on your symptoms, age, and general health. It will also depend on how severe the condition is. Early diagnosis and preventing further problem is critical in treating SCD. Treatment goals include preventing organ damage or including strokes, preventing infection, and treating symptoms. Treatment may include 1. Pain medicine, 2. Drinking plenty of water daily, 8 to 10 glass, blood transfusion, vaccine, and antibody they are used to prevent infection. For folic acid, 5. Hydroxyurea, 6. Regular eye exam, 7. Bone marrow transplant. Maybe that's all I can say. Thank you very much and see you. Wassalamualaikum warahmatullahi wabarakatuh.